Workplace Health Project Officer for Medway and Swale, working on the Kent and Medway Workplace Wellbeing Award. I'm joined by my colleagues this afternoon. So we've got James Flower, who is the Healthy Settings Programme Manager, my colleague Rakdas, who is Workplace Health Coordinator for Gravesham, Dartford and Swanley, and we're supported by Ricky, our colleague, who is monitoring the chat, and who's our Suicide Prevention Coordinator. So as I mentioned, we had a mental health in the workplace seminar a couple of weeks ago. If you have watched that and would like to watch it again, or you haven't yet seen it, there is a link here on YouTube so you can watch that at your own leisure. We had been joined by the lovely Elizabeth Williams from Connect 5, who spoke about the importance of mental health training in the workplace and how we can use that to support our colleagues. And so following on from that session this afternoon, just going to give a very brief overview of the Kent and Medway programme. And then there's going to be an opportunity for you to ask questions. I didn't mention earlier, we're also joined by Matthew Wallace and Kimberly Lloyd from Kent Community Health Trust, who run the One U Kent services. So we work very much in partnership with them. So you have the opportunity to ask questions either from the Healthy Workplace team or our colleagues from the One U Kent side of things, in terms of sort of workplace health and how our services can support you. We're open to have an informal discussion after a quick presentation, but obviously if there are sort of more pertinent or personal one-to-one things you want to discuss about your business, just let us know in the chat, send either Ricky or myself a private message, and we'll happily arrange a separate meeting after this at another date where we can talk about some of the issues you might have going on separately. Just some general housekeeping this afternoon. So it's a very informal session. Just ask people to keep themselves on mute unless when we get to the Q&A session. If you need to pop away from the computer for refreshments or a break at all, bear with me a second. So I just had a slight computer glitch then, and my computer started playing the YouTube video in the background, so I could hear that, and it was very difficult to talk over it. So I do apologise. So yeah, if you need to get a drink during the session or pop to the loo, that's fine. Just ask you to keep yourselves on mute while we are running through the presentation, and do feel free to pop any questions in the chat or raise your hand. And we shouldn't be more than an hour, so we should be keeping that keeping to that time frame for you. So just the impact of some health and wellbeing in the workplace. So some really great stats around the importance of it, which I'm sure you're all aware. So stress obviously is a big cost to the UK economy, a staggering 14.3 million working days lost due to anxiety and depression. Physically active staff taking 27% fewer sick days than non-active staff. So often employers might shy away from sort of what people do in their own time, but actually keeping people physically active and well does make them less likely to be sick, helps them to stay engaged and more productive in the workplace. And then 1 in 10 employees living with a musculoskeletal condition. If you think about our own workforces and actually how many people that sort of computes to, it's actually quite staggering, and another big loss of working days lost. And alcohol a factor in 27% of workplace accidents. I think fortunately in the UK workplace accidents aren't too common, but obviously anything we can do to reduce the likelihood of those and help people to live healthier and happier lives through all the time that we spend at work really is a good thing. So the benefits of a healthy workplace, I'm sure it's stuff that people are really familiar with. So being a healthy workplace obviously will improve the health of your staff. That in turn can increase productivity. And the thing that we often see through the programme the most is that boosting staff morale and engagement levels by feeling more looked after, more valued, and reducing staff absence and promoting you as an employer of choice. There might be lots of things you're doing already, and that's fine, and we can really help you to use the programme and the award that comes with it to promote your good work that you're already doing. There's lots of studies been undertaken by different universities and think tank bodies, and there's definitely a good return on investment. So the Kent and Medway programme, all the core services are free, but any investment that you do make in terms of time or extra resources you bring in will certainly have a good benefit to your business. So the Kent and Medway programme, we support sizes and sectors across the county, all sectors, all sizes, in addressing your workplace health needs. And we help you to identify the needs, looking at sickness and turnover. And we have a free to use staff survey if you don't have an existing survey in place. If you do have your own survey already, obviously we'll work with you to use that. We don't want to cause survey fatigue, but we can give you some pointers on things to ask around wellbeing, which might help you to identify some of the things that you need to address. So the programme will help you to ensure you've got the basics in place to develop a healthy workplace. And if you've already got those basics in place and already running initiatives, we can help you to evaluate what you're already doing and to build on that good work in a process of continuous improvement. The programme is very much led by the employer, so it's making pledges that are right for your needs. You know your staff teams better than we do. We're just here to give you guidance on best practice and the different things that you might be able to adapt in the workplace. And from those pledges that you make, that will form the basis of a health and wellbeing action plan in your workplace. So the award is broken down into levels, which keeps it nice and simple and helps you to track your progress. So level 1, as we've mentioned, is about really embedding that healthy workplace, that bronze award, making sure you've got the basics in place, the right policies are there, that senior managers are on board, you've got good facilities and good communication so that healthy workplace initiatives can be promoted and that staff have that opportunity to speak to managers and have performance monitored and so on to make sure that communication is open and clear. Then at silver and gold, we'll go into the themes in a moment, but there are 8 key themes of the award. It's all pledge based, so the 10 pledges at bronze are compulsory, then the 15 pledges would make a silver and you choose those pledges that are right for you. And a further 15 at gold, again, which are right for you. And for businesses that have achieved that gold award, there's that extra stretch in terms of them being able to move to platinum and for that continuous improvement from mentoring, influencing and taking the workplace health initiatives above and beyond just your staff, so to perhaps into helping families, the community, your supply chain, your neighbours and so on. So as I said, the bronze award, that's 10 compulsory pledges. So some of the examples are carrying out a needs assessment regarding your staff health and wellbeing, making sure senior management have bought into the process, completing a policy checklist to make sure your policies are up to date and accurately sort of reflecting health and wellbeing needs in the workplace, that you carry out regular risk assessments and that health and safety training is in place. And then silver and gold, as we've said, there's 15 pledges for silver and then 30 in total for gold. Obviously, you can make more if you're doing more already or more pledges are relevant for you. So these are the themes at silver and gold. So you'll see some really key public health topics here, which we are happy to advise and help you to run initiatives for. And then underpinned by some really key HR work around managing absence and turnover. And then in addition to that, the benefits of the environment on the workplace. So by that we mean the workplace environment and the effect that that has on people, as well as how our interaction with the natural environment and the world around us can support our well-being. So things like air quality, green travel and so on. And then that sustainability with that. So having a sustainable workplace and making your workplace health sustainable in terms of should the person leading on it leave, that it's embedded in the workplace and it can grow and develop from there. And then the Platinum Award, so if you've successfully embedded health and wellbeing and you can demonstrate continuous improvement, you become that advocate for health and wellbeing at work, you influence other businesses or maybe the community, you can then move on to the Platinum Award. And it's quite flexible, obviously there's no one size fits all, and the way that Platinum would work for different businesses really depends on the industry that you're in and the context that you have, so that's something that we're happy to work with you towards. So through the programme, there's lots of regular support available. We send out regular newsletters, keeping you up to date with current campaigns and events. Workplace health checks are available subject to availability. Obviously, great to have Matthew and Kimberly here this afternoon. I'll be happy to take questions on how that works in practice. Have our art and state-of-the-art health kiosk available for bookings. And then various other sort of stop smoking support, physical activity sessions and training available through the programme to support you on your health at work journey, in equipping your managers and staff to have that bit more knowledge, to help each other and to have a sort of programme with longevity. And for businesses who don't have that HR function, we do have sort of guidance available for policies on smoke-free, alcohol, stress and wellbeing. And even if you do have that HR function, we're happy to read over your policies and sort of give you feedback and any tips and advice on making sure that they're really up to date. So just a very brief word on how to sign up. It's great to see some of you here this afternoon. If you are interested in joining, you can register on the portal and we'll happily share that link with you today. Then we arrange an initial meeting with you, very much sort of like these slides, talking about how the programme will help you, but exploring a bit more in how it will actually work in your workplace and some of the needs and issues that you might be facing. But then follow up with any additional information you need and start off with the Bronze Award. So we do ask all workplaces, even if you've been doing healthy workplace things for a while, to at least do the Bronze Award to get those basics signed off, and then we can move on from there. So if you've been doing stuff for a while, there is the option to fast track to gold after bronze, or you can work through each level as to the silver and gold as well, just really depending on what's right for you. So it's a very flexible approach. That's the email address for the programme. So if you do want to discuss anything sort of a bit more private around health at work needs, please do feel free to contact us on workplacehealth@medway.gov.uk. We're happy to arrange a separate meeting where you can discuss any sort of more personal or commercially sensitive issues. That's about it from me. So I'm just going to sort of open up to any questions. So I've been seeing the chat flag coming up, which Ricky's been monitoring. So anyone got anything they